Hello, good morning. My name is Brianna and I'm a student nurse at Mountain View College, and today I'm going to demonstrate how to do tracheostomy care. I'm going to verbalize how to suction a patient, and then we're going to take the inner part of the trach out and clean it for fall 2022. So the first thing I'm going to do is check my physician's orders. I have Wanda Chi, 92019XX. It looks like he has ordered to have trach care done on Tuesday, Thursday, and Saturday using normal saline and suction at the bedside, PRN. I'm going to check. My patient has no known allergies, so I should be ready to gather all my supplies. So I'm going to gather all my supplies. I'm going to check the expiration dates. I'm going to verify that there's no tears or any damage to the packaging. Then I'm going to go ahead and head to the patient's room. And I'm going to have to move this around kind of as I go along here. Good morning, Miss Chi. My name is Brianna. I'm going to be your nurse today. The doctor has ordered for me to go ahead and clean your trach and do some suction. Can you go ahead and just let me know if your name is correct? Wanda Chi. She shakes her head yes. Is your date of birth 9/20/19XX? She shakes her head yes. Miss Chi, do you have any allergies that I need to be aware of? She shakes her head no, so we should be good to go. I'm going to go ahead and verify before I get started that her trach is inflated, just to make sure that it doesn't come out. And then this is the part that I'll just verbalize. To suction a patient, you would go ahead and you would do your vital signs first. You would go ahead and listen to your heart and lung sounds and for the need of the suction. Next, I would go ahead and check the wall suction. I would make sure that it is set between 100 and 120 millimeters of mercury for the suction strength. I would go ahead and lay that out here and get it ready to get started. I would also have my ambu bag close by and attach the oxygen and test it to make sure it's working before I begin. Next, I would bring the bed up to a working height, lower the side rail, set up my sterile field. I would choose a hand that would be clean and one that would be dirty. Usually your dominant hand would be the clean hand, and your dirty hand would be the non-dominant hand. Once I got ready to suction, I would attach it. I would use my dirty hand to hyperinflate or oxygenate the patient for 5 to 6 breaths before we get started. Once I put in the suction, I would go down till I meet resistance or the patient's gag reflex is started. And then I would twist and pull out for a total of 10 seconds max using intermittent suction. Once I've pulled out, I would go ahead and inspect the mucus that's inside. I would clean it out with normal saline, and then I would repeat the process for 1 to 2 more times. Once it is done, I will do another vital signs assessment and listen to her lungs again and make sure she's comfortable before we start the trach care. So now at this point, I would go ahead and wash my hands. I would put on gloves.
Comfortable position. I will also have them in high college. Once I do that, I'm going to check the suction. That is between 100 and 125. Once I do that,
Well, my bed is not going up for some reason, but we will go ahead and bring it up to a working height. First thing I'm going to do is inspect the dressing. I'm going to go ahead and look for color for any kind of extravate that's on it, any kind of drainage before. Then I would go ahead and remove my gloves.
While rotating out. And while this is sterile procedure, I'll sterile flow.
Sure.
Sterile precautions.
Okay, I would go ahead and document anything that I saw on the dressing. And next I'm going to get ready to set up my sterile field. I will have to move this around for you to see my sterile field, but just know that I would not normally reach across and touch anything. So I would go ahead and remove the cap.
I'll look at the gauze. I'll make sure that the consistency and amount. And then I'll discard. I'll look at the stoma, look at the size, and I would look kind of to make sure anything needs to be taken care of. So I'll discard my gloves. Perform hand hygiene. I just want to shoot out my go ahead and start this.
So this is going to be my sterile hand. So I would go ahead and have my water ready. Go ahead and remove all sterile things first. We go ahead and pour with my non-sterile hand. Put this down. Okay, then I'm going to glove my second hand. Go ahead and scoop. All right, so I'm gonna go ahead and finish getting this ready. Just kind of spread this out a little bit. Okay, all right, so I'm gonna move the camera. This is not part of the sterile part of the procedure, okay? Let you kind of see Miss Chi. Okay. So my hands are still sterile. I'm going to use this is going to be my dirty hands. I want to go ahead and remove the trach. And we're going to drop it into the sterile water. We're going to let that soak for a minute. All right, I'm going to pause and move the camera back over. Alright, so this is going to be my dirty hand. So with my sterile hand, I'm going to pick up my sterile instrument to clean.
The glove kind of fits that, but
Clean the whole thing. And then you're going to put it into a clean side.
Okay.
You're going to put this in the trash. Once this has been rinsed, I will then use my dirty hand.
And now I'll put my other glove.
Clean with sterile gauze, pat it dry, and then this is ready to go back into the patient. We're going to go straight back in. We're going to pause just for me to move the camera again. With my dirty hands, just going to insert it and snap it into place, and this completes the sterile part of the procedure. So now I'm going to finish cleaning the site. So you would take Q-tips, you would pour into the third section of water. So using gauze and Q-tips, we're going to clean around the site. And the outside of the appliance. And pat it dry. I would also take another set of vitals at this time, and if the patient needed to have oxygen, I would also hook that back up. Once I'm done, I'm going to go ahead and apply our new bandage. want to make sure that's nice and smooth. After that, I would go ahead and replace her trach collar. I would go ahead and inspect the skin around the back, make sure that I don't see any pressure injuries. You would put on the new trach collar before you take the old one off, because if they cough, the trach can come directly out. I would also make note of the size of the trach collar. Once that is replaced, you would make sure that you could fit just 2 fingers in the trach collar. You don't want it any tighter or any looser than that. Once the procedure is over, I would go ahead and lower the bed back down in the lowest position, make sure the collar is close by, check on her, make sure she doesn't need anything else, and clean everything up, remove my gloves, and wash my hands. Then I would go document the respiratory assessment, all vital signs before, during, and after. Document any thing that I needed as far as like the site, the skin, any drainage that was on the dressing, how the patient tolerated the procedure, how many times that I had to suction, and the characteristics of the mucus that was removed. I believe that's it. Thanks for watching.